When you open your patient's labs in the morning and you see a lactate of 4 that just came back, what does that mean to you as a bedside ICU nurse? My name is Leah, I've been an ICU nurse for 19 years, and we're gonna chat a little bit today about lactate. So it's included on the list of the labs that I call my pause and think labs, which means when I get those labs on a patient, if they're abnormal, I'm gonna really pause and think, and there's some steps that I'm going to think through. So when you see an elevated lactate, you should think, why are my tissues making more lactate than normal? Generally, it's because the cells aren't getting enough oxygen to meet their metabolic demands. This happens in things like sepsis, cardiogenic shock, any condition where the tissue perfusion is gonna be poor. It can also elevate if a patient has severe asthma, if a patient has had seizures, or if they're on really high doses of epinephrine. The first thing you should do is look at the trend. The lactate may be 4 now, but it was 7 on the last count and 10 on the one before that. So you're heading the right direction. If this is new and it's one of the first lactates that you have that are elevated, I'm thinking things like, what's the MAP? What's the urine output? And does this fit with the assessment that I'm doing visibly of the patient? Inside the ICU Success Academy, I teach a simple framework for helping you to interpret labs and know what matters at the bedside. I'd love for you to join me there. It's linked in my bio.